As we all know, age in the female is the biggest predictor of our fertility. However, we do use other factors that can tell us how well a patient would respond to fertility treatments if we were going to recommend them. Now, the reason that female age is the biggest predictor of fertility is because, unfortunately for us, we are born with as many eggs as we're ever going to have, and that number only declines with time as well as the quality. So again, that is something that's the most important predictor of fertility. Other things that we evaluate are something called day 2 or 3, meaning day 2 or 3 of the menstrual cycle, levels of estradiol and FSH, that stands for follicle stimulating hormone. At the beginning of the menstrual cycle, your estrogen should be low, and it's that low signal that feeds back to the brain and allows the brain to make FSH to tell the ovary to grow a follicle. Each follicle houses an egg that will be ovulated in that cycle. When we check those levels early on in the menstrual cycle, if the FSH is high or if the estrogen's high, and we know that's not what they should be at that time of the cycle, we know that the number of eggs in the ovaries is not as high as we would like it to be, and we associate that with something we call a diminished or decreased ovarian reserve. Other testing that we can do to evaluate the ovarian reserve is something called an antral follicle count. We perform an ultrasound on day 2 or 3 of the period and count the follicles. Remember, each follicle has an egg, to know if the patient has a good number of follicles to see how well, again, they would respond to fertility medications. And then lastly, we can also check something called AMH, which stands for anti-Müllerian hormone. Anti-Müllerian hormone is a hormone that's released by the cells that surround the egg. And if you have high levels, that's a good sign, telling us that probably the number of eggs in the ovaries is good. And if you have a low level, that again tells us that you might have something called the diminished ovarian reserve that may make it more difficult to respond to fertility medications.